Good evening, and thank you for joining in this topic of great health importance, both locally and globally. We all know somebody who has diabetes, and we think that they are taking a pill or an insulin injection and carrying on well. When it comes to diabetes and looking at the staggering statistics of diabetes, this is just the tip of the iceberg. 100 million US adults have either diabetes or prediabetes, of which 84 million have prediabetes and 34 million have diabetes. 1/3 of the US adult population have prediabetes, and 5 to 10% of them progress to diabetes in a matter of one every year. Now, diabetes increases with age, and 25% of adults above 65 years have diabetes, and the prevalence of diabetes is also increasing rapidly. For example, between 1988 and 2014, there has been an increase of about 382% in the incidence of diabetes, and it also decreases the life expectancy by about 12 years, and the healthcare expenditure is about $237 billion annually. Shasta County is not lagging behind in its prevalence of diabetes, because 50% of adults in Shasta County have prediabetes, whereas 18% of adults have diabetes. By the time many of them are diagnosed with high blood sugars, they have had it for a long time, and they are also on the verge of crippling complications. We always know that diabetes has link to the vascular and heart disease, and as a result, the crippling complications include blindness, heart attacks, strokes, amputation of limbs, and chronic kidney failure leading to dialysis. Now we know that we can prevent these complications by early and prompt action, which we are going to discuss in a minute. Now we are having these deliberations in the midst of COVID-19 pandemic, and we are recognizing more and more that those patients with diabetes who have COVID, they have increased severity, increased mortality, and need for ICU admissions. So apart from specific complications of diabetes, diabetes increases the susceptibility to various diseases and also impairs the healing and recovery. So these times, it also highlights the importance of preventing or delaying diabetes, as well as taking care of it in an effective manner. So early recognition and lifestyle intervention are key to achieve those. So who are the persons who are at high risk? Who are the ones we need to test and screen to find their high risk? All adults above the age of 45 years need to be tested, and then once every 3 years if they are negative. Now, and overweight, those above the age, above the BMI of 25 and in the case of Asian Americans, if they are above 23 and they have a first degree relative with diabetes, they have hypertension, vascular disease, and those who have dyslipidemias and cholesterol abnormalities, and those with physical inactivity, and some women with gestational diabetes also need to be tested. It's very important to realize that there are great racial and ethnic differences. For example, African American Latino, and Asian Americans, Native American population and Pacific Islanders have a higher incidence of diabetes, and it is important to focus these screening efforts on these populations. So, there is also a risk test available on Diabetic Association website to score who is at high risk, but these are the basic things to check for screening. Once they are identified, the screening and identification is easy. We just do a fasting blood sugar test, and if it is between 100 and 125, that is higher than normal, but not high enough to make the diagnosis of diabetes, they have pre-diabetes. Their hemoglobin A1C, which is a test that gives an average of blood sugars over 2 to 3 months, is between 5.7 to 6.4. They have pre-diabetes, and above that, that is 6.5, is diabetes. So, they have a little bit higher sugars, but not high enough. And once diagnosed, implementation of lifestyle intervention produces great results. The lifestyle intervention actually is just 3 main components. Weight loss, a 7% weight loss of about 1 to 2 pounds per week in about 6 months produces great results, and this can be achieved by nutritional measures. So, calorie and fat restrictions and carbohydrate restrictions or an individualized dietary plan can be arranged with a dietitian would be very helpful. Very useful diet is a Mediterranean diet plan, which has more whole grain, legumes, nuts, vegetables, and fruits, and avoidance of refined and processed foods. When it comes to fats, avoiding of saturated fats, trans fats, and taking healthy fats that are present in nuts, extra virgin olive oil that has more polyunsaturated fats and monounsaturated fats would be very helpful. Regular exercise is a very important component of diabetes prevention programs and lifestyle intervention. That includes 150 minutes per week of exercise, to include strength and endurance training and resistance training. It is also important to avoid smoking and introduce smoking cessation methods. Once these lifestyle measures are implemented without any medication, the results are impressive, and they have been proved in multiple trials. The diabetes prevention program trial showed a reduction in incidence of diabetes by 58% over 3 years. The Dodging study showed a 45% reduction in 23 years. It is also associated with reduced mortality. Uncontrolled diabetes decreases lifespan and increases mortality, and that is well demonstrated in these prevention trials. Now, the diabetes prevention outcome study also emphatically shows a 20% reduction in 15 years of progression to diabetes. There is always this question, is there a magic pill we can take instead of lifestyle intervention? All medications have been tried, but they are not as effective as lifestyle intervention, and they have side effects. But there is one medication, metformin, which has been recommended in those who are overweight with a BMI of more than 35 and age less than 60 years, and women with gestational diabetes history. So, apart from that, lifestyle intervention produces great results in preventing and delaying diabetes, and when ultimately some of them develop diabetes, they are in an excellent shape to have good control. So individuals with high risk should strive for early recognition and lifestyle intervention to improve diabetes control, and in condition as prevalent and advancing as diabetes, it's very important that different agencies, governmental, non-governmental, have campaigns and measures to increase the accessibility of screening, testing, and availability of lifestyle interventions. Investing in diabetes prevention is a great and efficient use of healthcare dollars and societal resources when it comes to either individuals with high risk or improving the population health. And towards this end, several measures have also been recommended, like subsidizing healthy foods like vegetables and fruits, or taxing sugar-sweetened beverages. So all individuals with prediabetes and at high risk should be encouraged to follow the lifestyle that makes a great investment in their future life. And there are programs of diabetes like diabetes self-education management that also can cater to provide services to the patients at high risk and prediabetes. We also live in unprecedented times of technological advance with the smartphones and availability of different apps to check the nutrition, to check the calories, to check the steps, and use of all these, all incorporating into healthy lifestyle, will produce great results. So efforts should be made to translate this knowledge and the technological advance into action to prevent or delay diabetes and decrease the suffering, get great control, and decrease the use of scarce healthcare resources. Thank you.